So in this lecture, we're going to be talking about joints, or the technical term for joints is actually articulations. And the reason why they're called articulations is it's actually the region in which two bones actually meet. There are actually two different ways that you can classify a joint. The first one is called structural classification, and all that tells you is what is that joint made up of. So if it's made up of dense regular connective tissue, it's called a fibrous joint. If it's made up of a cartilage, it's called cartilaginous joint. An example of a fibrous joint, folks, is actually your teeth. Okay, your teeth is actually connected, if you want to think about teeth as bone, it's connected to your mandible, or your maxilla in this case, through dense connective tissue. Okay. On the other hand, cartilaginous joints, an example of that would be between your vertebra. Okay. And last but not least, the third way that you can structurally classify joints is actually through this thing called synovial joints. And synovial joints are, in this case, knee joints, elbow joints. Okay, so those are because they're made up of a synovial cavity, which is actually made up, and then inside that cavity is actually a fluid. Okay, that's called synovial fluid, and that is actually a synovial joint. So structural classification: what is the joint made up of? The other way that you can classify joints is the movement that's allowed in joints. So you can have synarthrotic joints. Synarthrotic meaning no movement. Okay, so your skull, okay, so your frontal bone is connected to your parietal bone, okay, through the coronal suture. That suture, folks, if you push on your frontal bone right now, there should be no movement. Okay, so that is a synarthrotic joint. And then on the other hand, there's amphiarthrotic joint, which is just slightly mobile joints. And an example of that would be in your back. Okay, so as I said before, your vertebra is actually, in this case, subdivided between each other through cartilaginous joint. But what happens is there's not a lot of movement allowed, but there's a few. You can actually arch your back. And what you're doing actually in this case is you can slightly move that joint, that type of cartilaginous joint between your vertebra. And then obviously the arthritic joints is freely mobile joints, and that's actually all synovial joints. Now you have to understand that freely mobile joints, okay, is highly unstable, and the only way that synovial joints are actually controlled in movement is through a lot of structures, and predominantly ligaments. Okay, and the ligaments actually prevent this haphazard movement of joints, right? Once you tear up a ligament, then what happens is a movement that was previously prohibited or previously unhealthy in a joint then becomes much more common. Okay. This is an example of a synovial joint. This is actually your knee joint, and if you look at your knee joint, again, this is articulation. It's a synovial joint, which is also a diarthritic joint. As you can see, there's a lot of ligaments that actually surrounds this joint, and it actually makes this joint stable by having multiple joints. And since there's a lot of friction involved there, if you want to think about it, there's actually a lot of structures that prevents friction, and the meniscus does that, the articular cartilage does that as well, plus bursa. Okay, bursa in this case prevents, in this case, tendons and ligaments from rubbing against each other, and that's where the bursitis comes from. Okay, so you actually have an inflammation of the bursa. You don't really need to know the structure of most joints, but just know that there's a fluid inside the synovial joint called synovial fluid. A lot of, in this case, supportive structures like the meniscus, and a lot of ligaments, definitely a lot of ligaments, fibular or the lateral collateral ligament, and the medial collateral ligament, which is also the tibial ligament, because the tibia is on the inside of your leg, if you want to think about it this way. The key thing here, folks, is you need to know movements. Okay, so I want you to get in front of a mirror and try to practice this movement. Flexion, extension, hyperextension, folks, is all about 90 degrees or 180 degrees. So anytime you decrease the angle, okay, so if you extend this arm, you have to understand it's 180 degrees. When you decrease that angle, that's called flexion. All right. When you increase that angle up to 180, that is actually called extension. If you go past 180, that's called hyperextension. All right. And sometimes hyperextension is not a good thing. All right, just to let you guys know, hyperextension is no good, right? For most joints in this case. And then on the other hand, abduction adduction is talking about the midline. So if you imagine this model here, there's actually in this case, a midline here. Anytime that you take a joint away from the midline is called abduction, taking it away. Anytime you bring it back towards the midline, that's called adduction. All right. Circumduction is, in this case, rotational motion. And if you want to think about circumduction, just know that circumduction actually comes from conical motion. See, if you look at this, it looks like a cone. So if any joint, if you do a movement, it can do a conical movement. That's called circumduction. Okay, we have a lot of rotational movements here. Lateral rotation, okay, it means to, again, away from the midline. Medial rotation is towards the midline. Pronation, supination is about, in this case, your palm. Okay, so if your palm goes down, okay, if you want to think about that, that's called pronation. If your palm is up, that's called supination. All right. Supine is if you're like, you think about yourself when you're in the prone position, you're in your stomach, and when you're in the supine position, you're on your back. Okay. Special movements, depression, elevation, self-explanatory. And then we have some special movements. So this is the only movement that's actually involved in this case in your ankle joint. There's two flexions, right? Dorsiflexion, and the reason why it's called dorsiflexion, folks, is because the top part of your foot is called the dorsum of the foot. That's why it's called dorsiflexion, towards the top part of your foot. If you point your toes forward, that's called plantar flexion, and the reason why it's called plantar flexion is the bottom part of your foot, your soles of your foot, is called the plantar surface. All right? Then you have eversion and inversion. This is what happens when you wear high heels. Okay. Eversion is actually when you trip and you trip to the inside of your, again, ankle joint. And inversion actually is if you go on, in this case, the knife edge part of your foot. Okay, that's called inversion, right? So inversion, if you want to think about it, if you sit down, put your feet next to each other. If you can make your the soles of your feet point toward each other, that's called inversion. If you can make the bottom part of, or your plantar surface point away from each other, that's called eversion. All right. Protraction, retraction is again about in this case, about your mandible. Okay. So that's overbite, underbite, if you want to think about it that way. And then there's special movements for fingers. Opposition. Okay. In this case is when you can they actually do this for you to see like how good your hand and eye coordination is you actually touch your thumb to all of your fingers. That's called opposition. So the main key about joints, folks, is you need to know movements and you need to know the 3 types of joints based on function, okay, or structure, 2 ways. And also know that all of these movements is due to the interaction of bone, joints, and muscle. If you are missing any one of those categories or any one of those factors, there's no movement around the joint.